Welcome back to West Texas View.
Heather McKenzie, a mental health advocate for the Permian Basin, was telling us before the break that the San Antonio facility is a model in efficiency, cost savings for the community. It had saved millions of dollars for the city of San Antonio in the way that they're responding to the needs of the mental health and the families of those who have mental health issues. And so continue that conversation about what San Antonio's doing.
And San Antonio has what they call a jail diversion program, where
diverting the mentally ill away from the criminals.
Absolutely. And trying to keep them out of the jails, because the jails are not an adequate place for someone with a mental illness. They do not provide the proper care or the proper treatment.
It would seem to me that it would only enhance the symptoms of mental illness.
Absolutely. And for those that say that incarcerating them in institutions is cruel, my response would be jail is so much crueler.
And you're saying this as a mother.
As a mother, yes.
Of a much loved son with mental health issues.
Yes, and I cannot imagine that being his only option.
Now tell me when your son was diagnosed with mental illness.
My son was diagnosed when he was 18 years old. He had just graduated high school. He graduated with honors. He graduated with a pharmacy tech license. He was that smart, that brilliant, very popular, very outgoing, and it was literally as if someone flipped a light switch on my son. And
so something just broke.
Something just broke.
It's like catching a cold.
It is, and we do have a family history. My mother is also severely mentally ill. I often think that maybe I was given my mother so that I would recognize the things within my son. And
to prepare you to learn and to
learn. And
if
I hadn't had my mother, I wouldn't have had the knowledge, the small knowledge that I had when my son became ill. However, you know, once it's your child, it is a different facet. And I think a mother looking for answers does better research than the FBI.
I agree.
Determined. I could not accept the answers that I was given. And I spoke with Chief Burton, the chief of police here in Odessa, and we were talking about the Restoration Center, and he said, Heather, we absolutely need that in our area. He said, I have hollered and hollered that, you know, we need somewhere to take those in mental health crisis, and we have nothing. He said, do you remember the story about the officer who gave the gentleman his boots? He took the gentleman a pair of boots on a freezing day, and it was out in front of IHOP, and, you know, it got a lot of press about how wonderful the officer was for helping this gentleman. But Chief Burton said, Heather, they missed the whole story. The whole story is this man is severely mentally ill. He's sleeping on the streets, and we have nowhere to take him. We can't convince him to go to the Salvation Army, and we have nowhere safe to take him.
Plus, the Salvation Army is really not equipped for that either, even though it's a better
alternative than being on the street.
But it needs to be somebody that's really equipped,
educated. You know, we have I think at the most we may have 6 psychiatrists in Midland and Odessa combined. They are so overwhelmed.
In the whole
Poor
Permian
Dr.
Basin.
Jane, in the whole Permian Basin. Poor Dr. Jane, he sees his patients 2 to 3 back to back because he just has no choice. There's not enough here to address the situation. We've got to think outside the box. We have got to bring our community together. We need Texas Tech Medical Center. We need MH&MR. We need these facilities to step up and to get together a center that advocates and specializes in mental illness.
But it starts with understanding the problem. And I remember I was one of the early workers in rape crisis because, you know, so many times nobody was prosecuted in that. And a lot of it, of the solutions came when the police departments began training their officers. And then we sent advocates with the victims to the hospital so they got the right kind of evidence and all of that kind of thing. And so it really takes a village working together to solve the problem, because this is too big a problem for you as one advocate or you as one mom or for your family.
Absolutely.
And that brings us to the fact, and we're going to talk about this a little bit later, but one of the things that you're advocating for is we've got to give support to the families. We've got to give help because they feel so overwhelmed.
Absolutely. We have got to have some things in place. We need some support groups. When my son was very first diagnosed, I was told that I could go to grief counseling and do a grief support group. It just blew my mind. I thought to myself, how do I walk in there with these families who have truly lost a child? And I can say, my child is still here. Yes, I'm grieving what could have been. His life has changed forever.
Right.
He has a chronic, severe, debilitating disease that he will have for the rest of his life. But there was no support, no answers, no one to talk to. And
because your situation is totally different than someone who has buried a child. Because yours is still walking around, but from so many angles dead.
Yes. Absolutely.
And dead to the promise that he had, and so on. We're going to have to take a break, but when we come back next Sunday, when we come back next Sunday, I want us to continue this conversation because there's so many more facts and figures that the public needs to know. So we want you to join us next week because we're going to finish this conversation with Heather McKenzie. We'll see you then next Sunday.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.